Welcome to the Rocky Mountain University College of Optometry inaugural white coat ceremony. These guys are used to this. This is such a beautiful occasion and such a wonderful students for our inaugural white coat ceremony here at Rocky Mountain University. The white coat represents the purity of purpose in trying to have that compassion as we treat each and every patient we see, treating them as with dignity and with love. I knew I was going to do this. We have 9 children, but really we added 55 more. So when they come over to dinner, my beautiful bride over here, what a great opportunity. I'd like to introduce those here on the stage. First we have Dr. Cameron Martin, who is the president of Rocky Mountain University. We have Adam Hickenbotham, Dr. Hickenbotham, who is the dean of the College of Optometry. Dr. Donnie Akers, who is the dean of academic affairs for the College of Optometry. And we have Osama Said, Dr. Said, who's here representing My Eye Doctor, who has helped sponsor. Dr. Said is responsible and director for the residency and externship sites for My Eye Doctor. And they will also be some of those private practices that we will have our 4th-year rotations at. Those 4th-year rotations are currently have students from other universities there, so you'll be joining them in that 4th year in some of those rotations. So welcome. And then we have Sophie DeCanti. Close. Sorry. I've practiced that so many times all this day today, but she's class president for the 2026. And then we have Heather Briggs, who's going to be doing the reading. Let me just go through the program really quickly. First, we'll hear from President Martin, and then we'll hear from the sponsor, Dr. Said. Following his remarks, we'll hear from Dr. Hickenbotham, the Dean of the College of Optometry, and then we'll hear from Sophie. Concluding Sophie's remarks, that's when we'll do the presentation of the white coat, row by row, and you'll be indicated which row comes up from the left here. And as you come up in single file, there's a mark here that we would like you to stand close to because the photographer is going to be watching for you. Come close to that T, the blue T on the ground. So you'll be handing your coat to Dr. Hickenbotham, and we'll place that coat on. Please pause for a few moments and don't be in a hurry. Pause for a few moments, get gathered, and then we'll take your picture, okay? And then after that picture is concluded, then we'll have you go back to your seat. When the presentation of the white coat's concluded, we will have the reading of the oath, and then we'll have concluding remarks by myself. And so we'll go to that point in the program. President Martin.
Thank you, Dr. Wilkins. You are an awesome sight to behold. You really are. And your parents aren't so bad of a sight as well. We're glad to have you here today. This is an inflection point, one which needs to be remembered and honored. Your picture will hang on the wall, and you will be the inaugural cohort, the pioneers of Rocky Mountain University optometry program. So congratulations to you. This is quite a momentous occasion. Now, there's something you need to help me do, though, before we get to much further, and that is to show some gratitude to your family and friends and loved ones who are here in support of you, not just today, but to get you here to this point, and who will help get you across the finish line. So, with all the muster you have within you, stand, point to your mom and dad, your family, your friends, your spouse, and just give them a hoo-ha and clap and say thank you. Stand up, come on, say thank you. Say thank you. Say thank you. Now, will you also make sure you take the time to thank your faculty? In fact, let's take the time right now. Thank your faculty for their efforts in getting you here. Stand up, the faculty. Oh, they're hiding in the back. There they are. Thank you. Thanks for that. This is a fun moment, one that you'll remember, and one that I would like to encourage you to remember, in fact, 5 things. You're on your journey, by the way. This is impressive. Before I get to the 5 things, I understand that the entire cohort passed the clinical competencies, and you're moving on, and that is such an amazing accomplishment. So congratulations to you. What that also tells me is that you didn't leave anybody behind, that you were not just a cohort, but a family that cared for one another, that helped one another. I'm sure there were times where one of you thought, oh, just throw in the white towel, and then, no, you don't do it. We got you. And then it was the person saying, no, we got you, who the next week said, throwing in the white towel. No, we got you. You all helped one another. And that's very evident. Very evident by the outcomes of you and your cohort. So congratulations to yourself. Now back to the 5 things. And I know you can remember these things because you're optometry graduate students at Rocky Mountain University. So there are 5 things you can remember, all right? And this is important. First, I want you to remember why you're here. You all had to put in your application what you espoused to do, what you're trying to do. Now you got a little rhythm, and you got some seasons experience behind you, preparatory to the next process in your educational journey. But don't forget why you did this, why you're here. In essence, remember to be yourself. We're not trying to train you to be like Dr. Hickenbotham, thankfully. No offense. Or Dr. Wilkins or Dr. Akers or anybody else. We're training you to be the best you. So part of remembering your why is to be yourself. The second I'd like you to remember is remember what it's like to be a patient. You've all been a patient of an optometrist. Remember what it's like. And those are the healthcare professionals who have helped you along your path, the ones you remember the most are the ones that were present with you, right? That they remembered what it's like. So be present. Be present. It may be as you get out there and start seeing people, it may be the 20th person of the day, but it's their first time with you. So be present with them. Remember what it's like to be a patient. The third item is I want you to remember to trust your training. You're going to get in moments and you're like, oh, that's what I do. Breathe, reflect back, go through the steps, trust your training. You know more than you think you do. And your faculty have prepared you well, and they're continuing to prepare you. So if you have questions, ask. Don't fake it. Just get in there and say, pause, step aside, come back, whatever it is. But I want you to remember you've been trained for this. So trust your training, all right? In essence, be humble. To be humble is to know what you know what you don't know, and be malleable in learning what you need to know to best care for those you'll be aiding with your various rotations and experiences down the pike, okay? All right. So the fourth is remember to say thank you. In essence, be grateful. Be a grateful clinician. Be one who appreciates the patient, the colleagues, the front desk, every person within the organization. Be a thankful person. That gratitude will open hearts and minds, and people will remember you. And one of the things they'll remember you by is the fifth item. The fifth item is to remember that it is your hand in that logo. Look on the shield there on your white coat. You see that hand that creates the mountains and the valleys where we're located here in Provo, Utah. But that's your hand. That's your hand that has been trained to be a steady one, to aid the persons that you'll be assisting with and working alongside of. That's your hand. In essence, be an ambassador of RMU. That means something very special. Because this is an institution that just isn't here just to train and get you out. This is an institution who's dedicated to advancing the knowledge base, the efficacy of healthcare. But it's also one that's dedicated to improving the human condition by loving and lifting those in need. To love someone is to see them for who they are, figuratively and literally. I can say that with this group. Also, to meet them where they are, to listen to what they say, to understand what they're experiencing, and then to lift them and trust the training you've been given to lift them, to improve their quality of life, their experience, thus improving the human condition for the many, one patient at a time. You have been well prepared. This is why we exist as an institution, to improve the human condition, to love and lift those in need. And you are now a part of an ambassador of this brand as you go out. Trust it. Be thankful for it. Remember what it's like to be a patient, and remember why it is you got into this business to begin with, because you're going to help people see the world anew each day. Good luck to you, and congratulations. We're so honored to have you here, our first cohort of our optometry program, the pioneers of RMU Optometry School. We appreciate you. Congratulations.
Wow, it is truly an honor and a pleasure to be here with all of you today. You are going to think that all of us, kind of corroborated on our presentations because the theme is the same, but we didn't. And the theme is the same for a reason, because we all approach this profession the same way. And with the short few minutes that I have here, first of all, I want to congratulate all of you for this amazing journey. Optometry is an amazing profession, and you guys are in for a wonderful, wonderful career. So hats off to you. Congratulations. You're going to go on to do absolutely amazing things. Really well. And with the short couple of minutes I have, I want to talk to you about two things that I felt have become very crucial to me in my 25 years of practicing. I've had the pleasure of mentoring over 200 students over a 25-year career. 25 externs have come through my office. And the theme is always the same, to teach them what I want to talk to you guys about today. Service and compassion. Right? You will get the clinical training to be wonderful optometrists. But what I want you to take away from my message today is your clinical skills, diagnosis and treatment, is not enough. What this profession really needs is your compassion, for you to really understand what your patients are going through, what these conditions mean to them, and how being a compassionate and healing provider will make a huge difference. So that's my request of you guys, is lead with compassion, lean on your heart, understand that what you're treating these patients for is so much more than an eye condition. Right? Your job, you may think that your job is to get your patients to see better, and it is. But equally as important It's for your patients to be seen, for your patients to be heard, for your patient's voice to be heard to you, and for you to share the compassion with them. Sometimes a hug, a stroke on the arm, a pat that says, Miss Jones, you're going to be okay. We're going to go through this together. I'm here to make sure that we help you see for as long as you can and preserve your vision. That is more important than a diagnosis. Other thing I want to talk to you guys about regarding compassion is, again, synonymous. You may think that you're treating eyeballs. And I want you to remember, Dr. Saeed said, we are not treating eyes. You're treating the person behind these eyes. They have lives and they have families. So understand that you're taking a holistic approach to their medicine. What does this diagnosis mean? What does this treatment plan mean? What is the outcome for my patient? So always lead with compassion and service. Second thing I want to talk to you about is the tough journey ahead. You all know what you signed up for. Optometry school is challenging. I'm not going to lie to you. You will have many, many, many sleepless nights, tough exams, lots of studying, many espressos, and you still will be sleepy. But as you study for your exams and you hit the books, I want you to understand and always keep in mind why you're studying. You're not studying for an exam. You're studying because your patients are going to put their care in your hands. Every single time you get tired and you think to yourself, I'm not sure I can do this, understand that you are not studying for a practical. You're not studying for an exam. You're studying for the sakehood of your patients, and keep powering through. Mediocrity is what's normal for us, but when you push yourself, you'll notice that you can achieve great things. I can't wait to call you all my colleagues. It is an absolute honor and pleasure to be here in this inaugural class, and I wish you all the best of luck. Thank you all so much.
Right. Thank you, Dr. Saeed. Thank you, President Martin. Thank you, Dr. Wilkins. I had forgotten how good looking you guys are. I remember all the midterms and the finals, and you haven't looked this good since your interviews. So this is our inaugural class. So this is a really, really special class. Now they're starting to get a little bit jealous because we're having a second class in. And I hear them asking all the time, who's better, Dr. Hickenbotham? Is it better one or two? I'd like to thank our faculty again. Our faculty has been amazing. So they are there after hours helping our students to learn. They're always available to our students. Anytime they have questions, they can come and see them. So I'm just excited that we have had such great faculty. And we're adding new faculty too. So you'll have, in your third year, you'll have even more faculty, exciting new faculty as well. Thank you to the family. I was able to meet some of the family members here. I hope I can meet some more of you afterwards. Some of you traveled from Florida and from Louisiana and from Texas and from all over the place, Michigan. Exciting that you guys can come. We'll see you again in 2 more years when they're graduating, so you can get another trip out here. It'll be a little colder next time because it'll be in December, so bring your ski goggles and your ski gloves and your snowboards and anything else you want to bring with you. So this is exciting. You're going to start in clinic. You've already had some experience. I remember my first patient in clinic. The patient came in, sat down, and I said, what's wrong? And the patient's like, I can't see things far away. And so I said, well, let's go outside and see. So we went outside, and I said, well, what's that up there? And the patient's like, that's the sun. I was like, that's 93 million miles away. How far do you want to see? So anyway, thank you so much. We're looking forward to another 2 years. So, and I'm just so grateful that you chose to come here, and hopefully we've given you a good experience. And again, my door is open, so if you guys want to come and meet with me anytime, I'm happy. And just thank you for coming today, and thank you for their families. Thank you.
It is a beautiful day to be celebrating such a momentous occasion. Today we recognize our hard work, our perseverance, as we take the next step towards becoming optometrists. But reaching this point has not been easy. We have spent countless hours studying and stressing as we prepared for exams and practicals. From our first day of optics, when we were worried about ray diagrams, to asking endless questions about cover test, it makes me smile to remember just how panicked we were over concepts that now seem so simple. Yet somehow throughout the struggle, we have often found ourselves laughing and smiling as we supported each other throughout our journey. Throughout the past year and a half, we have created memories, built friendships, and for some of us, have found our life partners. Apart from receiving good grades, it is the dedication to learning skills outside of our classroom that has set us apart to be exceptional doctors to be. From building clubs and organizations from the ground up to providing help on mission trips to those in need, we, as the inaugural class of Rocky Mountain School of Optometry, have laid the foundation for generations to come. And as Rocky Mountain's first optometry class, we have had a unique experience. Not only have we been growing as students, but our professors have been growing too. We sometimes left lectures more confused than ever, but we were never upset as we knew our professors truly cared. They demonstrated their dedication to our success as they often worked long hours inputting grades late at night, stayed after school so we could practice our skills, and always had their doors open whenever we had questions. It has allowed us to create a special bond, and I am sure we will be in each other's hearts for a lifetime. But it has taken a village to get to where we are today. I want to take a moment to thank our friends, family, and RMU staff for their kindness, comfort, and sugar-coated treats. Thank you for our practice patience and allowing us to shine a bright amount of light into your eyes and perhaps asking a few too many times, which is better, 1 or 2. But of course, I can't forget to thank our incredible professors. What makes our school great is that our professors aren't just faculty, but more like family. They have not only inspired us to become doctors who go above and beyond, but they have often believed in us when we didn't believe in ourselves. I remember early in our journey, my slight disbelief when Dr. Roden was on our team, as he flew through 100 slides in under an hour. But I now realize that he and all of our professors are truly on our team. As the nation's newest optometry school, we are pioneering the way to a new future of optometric medicine. With the hard work of our visionary deans, we are becoming well-rounded doctors. We are learning a more advanced curriculum that allows us to practice techniques earlier than other schools. I remember when Dr. Crouch taught us gonioscopy, a technique that even some experienced optometrists are nervous to do. We are also the first program to send students out to real clinic sites as third years. But with that being said, to quote Hamilton, history has its eyes on us as we are the forefront of change in optometry. We are both nervous and excited as we receive this coat, but are prepared for the challenge. Rather than learning from textbooks, we will be learning through our patients' stories. Receiving this white coat symbolizes the trust that is bestowed upon us by our community, and it is a reminder of our dedication to learning, caring, and giving as we impact countless lives. I often think of Dr. Price's favorite quote, "There is no professional who has more power to change a person's life than an optometrist." So although the road ahead may seem daunting, we are ready to grow into the doctors we aspire to be. So from this day forward, take pride in how far you've come, have faith in how far you can go, and most importantly, never forget the journey.
Brooke Anderson. Unfortunately, our next student couldn't be here with us today, but we wanted to honor his name as he has also earned his white coat, Mina Atia. Hannah Bannister. Dakota Barnett. Margaret Beauchamp. Adrian Brizuela. Tony Brown. Daniel Browning. Spencer Call. Bracken Campbell. Joelle Cardenas. Danielle Koval. Callie Cohen. Sophie Dakanai. Marlise Diaz. Joshua Dusek. Nelson Eggett. Jared Eskahuri. Connor Flaherty. Jared Foster. Jasmine Gonzalez. Rachel Ha. Ann Henningsen. Christina Ho. Aaliyah Horsley. Nathan Howdyshell. Savannah Huff. Delunchier Jean-Philippe. Victoria Laws. Myra Lucero. Iceland Martinez. Brock Merrill. Paulina Mesa. Landon Moran. Caitlin Naughton. Erica Olson. Braden Paget. Sarah Elam Paget. Anjali Patel. Dolly Patel. Dallas Peterson. Melanie Pham. Shannon Pham. Josue Puente. Javier Ramirez. Mary Saba. Jessica Salama. Naseem Shapuri. Anmol Sang Jasar. Cooper Smith. Jalea Sosa Rivera. Tiffany Terry. Kirsten Ungrich. Annabelle Van Ash. Milena Johannes.
Thank you so much for, there we go. Thank you. Whew, that was exciting, wasn't it? So it was a wonderful opportunity for us to congratulate you and honor you, and a wonderful opportunity for us to commemorate all the hard work, sweat and tears sometimes that you've put in to get to this point. So what we'd like to do before I give a few closing remarks is that we would like to do a reading of the optometric oath, okay? Now, the optometric oath, it was longer than I remember it. When it was, so the optometric oath in there, what it does, it tells you for the doctorate degree that I have been given, okay, you still have a little bit of time, a little bit of tears, and a little bit of hard work that needs to go in before we get that. So we'll kind of put in will be given, okay, in the future. So I would like you to arise. Okay, let's stand up. And we can endure to the end on reading this together and going through. And I've read this probably 5 or 6 times today, and I don't think I've gotten through it once without making a mistake. So this time, let's see if we can be able to read this through, and we'll just read it in unison all together. It has such a really critical meaning, so we can kind of take it easy, take it slow, and we can go ahead and read through this. Okay. With full deliberation, I freely and solemnly pledge that I affirm that the health of my patients will be my first consideration. I will practice the art and science of optometry fully and conscientiously and to the fullest scope of my competence. I will uphold and honorably promote by example and action the highest standards, ethics, ideals of my chosen profession, and the honor of the degree, Doctorate of Optometry, which will be granted unto me in the future. I will provide professional care for the diverse population who seek my service I come with compassion and with due regard for human rights and dignity. I will work to expand access to quality care and improve health for all communities. The treatment of those who seek my care above personal gain and strive to see that none shall lack for proper care. I will hold a privilege in all information entrusted to me in confidence by my patients. I will advise my patients fully and honestly of all which may serve to restore, maintain, or enhance their vision and general health. I will strive continuously to broaden my knowledge and skills so that my patients may benefit from all new and just means to enhance the care of human vision. I will share information orderly and unselfishly with my fellow doctors of optometry and other professionals for the benefit of patients, knowledge, and welfare. I will do my utmost to serve my community, my country, mankind, as well as a doctor of optometry. I hereby commit myself to steadfast in the performance of this my solemn oath and obligation. You can be seated. Thank you. I wanted to truly give a few moments that we would like to give some thanks. I know we have already, but I truly want to give some thanks to our faculty. The faculty are top-notch. You don't understand or know how good you have it with the faculty that we have, because they have open door policy and they truly love and care for each one of you. They really, truly do. You don't find that in a lot of the universities. You have a dean that has an open door policy also. My dean, I saw him when I went to my first class, and I saw them when I walked across the stage. That was it. I didn't even know really who he was. But you do. You know who Dr. Hickenbotham is, and he cares for you, and he really wants all the success in the world for you. Also, Dr. Akers, tirelessly working to organize and work with the faculty to put together the program that he has. He has done a tremendous, tremendous job. And so I think that we need to have a round of applause one more time for our faculty and administration for all the hard work and the love that they share for you. There is one thing that I've noticed about your class. Your class have truly come together as a family. It's been mentioned many times before that you don't leave anybody behind, and that is so true. I've seen it so many times. You have a love for your fellow student or peer. You have a love for your faculty. Some days you might not, but I know most of the time you have a love for your faculty. And I know that you have a love for your patients. You truly have embodied that wonderful saying from Tennyson, that love is the only gold. I have been on so many of our outreach. We have seen well over 1,500 or more, everywhere from the Crisis Center in Richfield to the Special Olympics. And we've had them in Salt Lake. We've had them in St. George. We've had them in all different places. We've had them on the reservation. I've seen your compassion and your love. We've run clinics in Moab. We've run clinics in Salt Lake, the refugee centers in Provo. We've run clinics in Title I schools throughout Utah. I've never been prouder than to have you, students, by my side working to improve the human condition. You gave sight where it was needed so people could accomplish their jobs, they could go to school, or more importantly, that they may be able to actually see some of their family members and friends. You made a difference in their lives. Your care made a difference. Our last event, one of the last events when we went to the Navajo reservation, we had a 2-day event. It was fun and exciting. It was a great area. By the time we were getting to the end of that event on Saturday and everyone was looking at trying to pack up and go home, we got word that we had a few more people coming in. No complaining. They just wanted to stay. They stayed. All the students stayed. No, like I say, no complaining. And we waited until those people came to the event. And the final woman that came, she'd walked 3 miles to get your services, to have her be able to see, to take care of her visual needs, so that she could perform her duties in her home and in her job. That is what caring's all about. That's what the compassion and service to uplift those in need. Please remember to listen to your patients. Be compassionate. Think of them as the most important person as you deal and take care of their visual needs. Not only visual needs, it spills over into their personal needs, their general health care needs. Remember to always love and care for them. Truly, the words keep coming to my mind from a song that was made famous by Wicked. That's a play, okay? For good. I'm going to change the word just a little bit. But because I knew you, or I know you, I have been changed for the good. And I truly believe that with all my heart. Each one of these people here love, care for, and want to have your success, because you will carry on throughout the world and make it a better place and uplift those, the hands that hang low. And you will care for those patients with the kindest and most compassionate heart. And I know you will. I have all the confidence in the world in each one of you. You're on a journey. Now the clinical journey starts through your 3rd year and your 4th year. And that journey is going to be a fun, exciting. There will be some apprehension, I know. Some of you are shaking your heads, yes. But look forward with that faith in what you've learned and the skills that you have managed to successfully learn and understand and apply that. You truly are. Truly, I feel like my kids, okay? And you have the hearts of gold. And it really has been an honor thus far to be a part of your educational experience. So thank you. So this concludes our white coat ceremony. What we would like to do is, before you start mingling, if we would gather up here on the stage, and we're going to take a group photo, and then please, you can go out into the foyer here, and we have refreshments after that photo's taken, and enjoy the time together in mingling. So thank you very much. Can the faculty please come up too, the faculty?